Okay, underneath the pectoral muscle terms, you're going to see the word antebrachial fascia, and it's antebrachial with an N. And so if you remember, the humerus is the brachium, and the ulna and the radius is the antebrachium. So the antebrachial fascia is the fascia that is on the antebrachium here, and those are important because that's how the pectoral muscles connect to the upper arm. And so these muscles right here are all pectoral muscles. And the first one, well, two are part of the superficial pectoral muscles, so the pectoralis superficialis muscles, and you'll see that I'll have two M's versus one M with a dot, and the two M's is just a muscle complex. So these right here are part of the muscle complex of the pectoralis superficialis. And the first one, that is where deep, is the pectoralis descendens, which is here and connects here, pectoralis descendens, and underneath it is the pectoralis transversus. And these both connect to the more cranial 1/3 of the sternum, and the sternum would be under here, and you'd be able to feel it. And then for the lower 2/3 of it, you have the pectoralis profundus here, and then the xiphi humoralis here. And the xiphi humoralis, it originates on the xiphoid process of the sternum, and it inserts on the humerus, so that's a way to remember it. And those are in a part of a muscle complex. And then also you have the cleidobrachial, which we'll see in multiple sections. But if you just think cleido means clavicle, so whenever you bisect it, this is the cleidobrachial. Whenever you bisect it, underneath here you'll be able to feel the clavicle, and the cleidobrachial connects there, right there, and it's just right above. It covers part of the shoulder, and it is more cranial to the pectoralis descendens there. And then for the trapezius muscles, you'll need to look on the underside, or the back. And they've been cut here. They normally connect like that. And trapezius is just referring to their shape, which is supposedly trapezoidal. And you can kind of see the ones that are articulated here. The cervical trapezius would be the ones that connect to the cervical vertebrae, so here and then here. And then the thoracic trapezius muscles is the ones that connect to the thoracic vertebrae. And you may want to look at it from a different view, like when they're not articulated. And so whenever the cervical trapezius is going to be the one that is mainly on the scapular spine. And then the thoracic trapezius, only like one little corner of it will be connected to the scapular spine here. And also you'll see the brachiocephalic muscles, and those are applying to like the cleidobrachial, which again was here. And those we'll revisit later, but in those, whenever you see like cleidobrachial, it comes from the clavicle. So the clavicle's here, so the cleidobrachial would go from the clavicle to the brachium. The cleidomastoid would go from the clavicle to the mastoid, which would be up in here, which you can't see as clearly. And then the cleidocervical, which you can see here that's cut, goes from the clavicle to the cervical vertebrae. The cleidomastoid would be the part that's up in here that hasn't been clearly dissected. And those are all part of the brachiocephalic muscle complex. And then for the sternocephalic muscles, it's hard to see in here, but they're the ones that go from the sternum to the head. So the sternomastoid would go from the sternum up to the mastoid, and then the sterno-occipital would be deep in here if you cleared away the connective tissue, and it would just go back to the occipital bone, and you'll see those later. And that's it for those.